My name is Miguel Roberts. I'm a clinical psychologist with the DCVA. I'm the Director of Trauma Services in the PTSD Clinic. So PTSD Awareness Month was started in 2010 by an act of Congress that established June 27th as PTSD Awareness Day. And we think that that's important because to educate veterans about the signs and symptoms of PTSD, that help is available and that treatment works. PTSD clinic is a requirement from the VA's Uniform Mental Health Handbook that establishes a requirement for a PTSD clinical team at the medical center and at the C-Box. So we're a team that specializes in providing services for veterans with PTSD. Requirement for a screening for PTSD is something that is established nationally for the VA, that all new veterans that come in to the VA are screened for PTSD. I would say some of the more common symptoms are some what we call re-experiencing symptoms of PTSD immediately following a traumatic event. Those include the nightmares, the intrusive memories, that the memories of that traumatic event come back to you at times when you don't want them to. And then there's also the avoidance cluster of symptoms that they avoid thinking about the event, they avoid things that remind them of the event. And then there are changes in the way that you think about the world, the way that you think about your relationships. So the Trauma Services program here at the DCVA provides evidence-based psychotherapies. All of our providers are trained in the delivery of evidence-based psychotherapies, including cognitive processing therapy and prolonged exposure. The VA's made a tremendous investment in training providers to deliver those evidence-based psychotherapies and then provided additional support unparalleled in the private sector. I would want all veterans to know that treatment works and that you're not alone. We know that those experiences after a traumatic event are common and that recovery is possible.